Hello and welcome to the program from China. In today's episode, I will talk about rotator cuff injuries. Stay tuned and learn more about the shoulder joint, how rotator cuff injuries can occur, signs and symptoms, and treatment options. Many tennis players encounter shoulder problems throughout their career. So let's take a closer look at the shoulder joint. The shoulder joint, or glenohumeral joint, is a multi-axial diarthrodal or ball and socket joint that has the greatest movement capabilities of all joints in the body. Because of its superior movement capabilities, it lacks stability. Stability is sacrificed to enhance mobility. Even though it is a ball and socket joint, the glenoid fossa, the socket portion, is relatively shallow and the ligaments are lax within normal movement ranges. Therefore, other structures are needed to keep the humeral head, the ball portion, in place. Those structures that contribute to stabilize the humeral head are cartilage, ligaments, muscles and tendons of the rotator cuff, namely supraspinatus, infraspinatus, teres minor, or subscapularis. Take a look at the following image. As you can see, the supraspinatus, infraspinatus, teres minor, and subscapularis keep the shoulder in place. The most common injuries are shoulder dislocations and tears or inflammation to the tendons of the rotator cuff muscles. Shoulder pain is generally caused via impingement or tendinitis, scapular impingement or rotator cuff tendon tears. The rotator cuff muscles are small compared to the deltoid or bicep, and hence they require adequate strength and endurance to ensure proper functioning of the entire shoulder joint. Due to prolonged and repetitive activities, especially overhead movements like serving, the small rotator cuff muscles cannot maintain dynamic stability due to muscle fatigue and/or factors such as muscular imbalances, poor technique, inadequate warm-up, strengthening and stretching. All these aforementioned factors can lead to rotator cuff tendinitis or rotator cuff impingement. Rotator cuff impingement occurs due to pressure caused by the acromion, where the arm is lifted because the acromion rubs onto the surface of the rotator cuff, causing pain and limiting movement. Sometimes the bursa just over the rotator cuff can be inflamed and hence causing pain as well. Generally, an individual suffering from rotator cuff injury will experience one of the following: pain when the shoulder is moving and/or at rest. 2. Stabbing pain when lifting or moving objects. And 3rd, the pain center can move from the front to the side. A variety of treatment options are available: surgical and non-surgical. Initially, patients are advised to stop any overhead activities and rest the shoulder for days or weeks. Icing and anti-inflammatory medication generally accompanies the rest period. If the pain is more severe, cortisone shots can be applied to the affected area, for example the bursa. Another option is a physical rehabilitation or strengthening program that would include resistance training exercises such as internal shoulder rotation, external shoulder rotation, shoulder abducted external rotation, shoulder abducted internal rotation, and 5th, supraspinatus lateral raises. During internal shoulder rotation, rotate at the elbow by pulling the elastic band at hip level towards the body, thereby moving the hand towards the umbilicus without moving the elbow away from the trunk or hip. It targets the subscapularis. During external shoulder rotation, rotate the elbow, pulling the elastic band at hip level away from the body, thereby moving the hand away from the body without moving the elbow away from the trunk or hip. It targets the infraspinatus and teres minor. During horizontal abducted external shoulder rotation, abduct shoulders to 90 degrees, flex the elbows and hold elastic band in both hands. Rotate at the elbows until hands point upwards, thereby pulling the elastic band. It targets the infraspinatus and teres minor. During horizontal abducted internal shoulder rotation, abduct shoulders to 90 degrees, flex the elbows and hold elastic band in both hands. Rotate at the elbows until hands point forward, thereby pulling the elastic band. It targets the subscapularis. During supraspinatus lateral raises, stand up in athletic position with arms close to the body and thumb pointing inwards. Abduct shoulders to 90 degrees and slightly rotate the arm so that thumb points forward. It targets the supraspinatus. When non-surgical treatments don't relieve the pain, then surgery might be the last option to create more space for the rotator cuff, which removes any impingement of the rotator cuff caused by the acromion of the scapula. Two common surgical procedures used are subacromial decompression or anterior acromioplasty. During the surgery, a piece of the acromion and/or parts of the bursa are being removed either via open incision or arthroscopic procedure. After surgery, a sling is used to remove pressure from the shoulder, speeding up the recovery process. Once the pain subsides, the individual starts a physical rehabilitation program that aims at strengthening the rotator cuff muscles while ensuring proper functional range of motion. Recovery from surgery and return to full range of motion can take anywhere between 2 to 12 months. Well, that's it again for today's episode. As usual, opinions differ. What's your point of view? Let us know below in the comment section. A brand new episode will be available next Sunday. So make sure you don't miss it and subscribe. In the meantime, I recommend you watch some of the previous episodes. You should really watch them all. If you like what you saw, tell your friends. I'm sure they will appreciate it. I'm Philipp Halfmann. Thank you for watching and auf Wiedersehen. Tennis Conditioning TV episodes are licensed under Creative Commons. You are welcome to link or embed these videos, forward them to others, and share these ideas with people you know. Brought to you by Advanced Concepts of Strength and Conditioning for Tennis. Available at tennisconditioningbook.com. Music by Dan O at danosongs.com.